Hi, I'm Lauren, creator of Lauren Bean Occupational Therapy. I'm an OT in the inner west of Sydney, and I've created this series to help people that have had stroke or brain injury or their therapists start to regain some functional use of their affected arm. So this video, I'd like to talk a little bit about the shoulder, because often that's a good place to start in the early days of stroke or brain injury. So I've already spoken about positioning of that shoulder and making sure it's in a supportive sling if there's not enough active movement, or putting it on a supportive type of equipment or furniture to keep it into place. So from here, we want to look at range of motion. So rather than trying to just move the arm, we want to gently see if we can bring it into the different planes that it's supposed to move into, okay? Make sure that you work within the person's pain limits. It shouldn't cause pain. If it does, it's too early to do this. And it's often easier to do this when the person is actually laying down on their back, so that gravity is not pulling on the arm at the same time. I'm just demonstrating in the seated position. So the most functional movement of the arm is actually forward flexion, or the coffee cup grab. So you want to be able to bring it forwards and also up to reach things, and then back down again. So that's a good place to start. There's also extension or behind, but today I'm going to show you the forward flexion movement. So using the other arm to support it, just along the forearm, sitting up straight with good posture if that's possible, and trying to bring the shoulder blades or the scapulars back as well, okay? And if not, we're just in a supportive chair. So we're just gently going to passively move or bring that arm outward as far as is comfortable. So we're not yanking it up here, we're just moving it forward and then bringing it back. And remember, 1,000 repetitions. So you would do this hundreds of times, if possible, every single day. Okay, so that's the first one. And then abduction, or bringing the shoulder out, or angel wings out to the side. Supporting the arm, moving it to the side a little bit, and then back again. And shoulder adduction, or toward or across the midline of the body that way. That one can feel a bit yucky though, so I would just go out to the side and bringing it back, up to the side and bringing it back. So we've got forward flexion. They call this the cradle. Obvious reason why, hey? They the other experts in the field that have come up with these really creative names for passive range of motion. So you're doing this with the client, or the client's doing it with themselves. They're not at this point yet trying to move with it. It's not active assist, it's just passive range. So this arm is limp, no movement. This arm is supporting it and moving it into place, okay? You could also use a table or a desk. Get some talcum powder, dishwashing detergent, maybe something not too messy or annoying or anything that the person's allergic to. You would do it so that you're actually facing the table, but I'm going to be side on just for the purpose of this video. So again, resting the forearm on the table, you've got your slippery surface here, and then you're moving it very gently forward and then back, forward and back. Try not to move the trunk because that's cheating. We're just trying to get that movement from the shoulder, forward and back, forward and back. Same with the angel wings. You're gently going to bring it to the side and back in, side, in. The other movement that you could try is the shoulder shrug. This does require scapular activation though. So where we're just trying to bring the shoulder up toward the ear or up toward the ceiling. So again, you support the forearm, sitting up as straight as possible or in a supportive chair, and then you're just bringing it up and gently lowering it back down. Bringing it up, lowering it back down again, bringing it up and back down. And one more thing is internal and external rotation at the shoulder. This one can feel a bit yucky, so it might not be time for this one yet. I just wanted to show you how to do it. So rather than do it like this, which might be a little bit awkward, use that table or desk again. So you have the arm supported on the slippery surface, and you're gently going to externally rotate and then internally rotate just a little bit. Externally, internally. Open the gate, shut the gate. Open the gate, shut the gate. Okay, just a few different ways that you can do that. So we've got the forward flexion, gently bringing it down. Forward flexion. Abduction, angel wings. Angel wings. We've got the shrug. Shrug. And then we had that external and internal rotation. Again, within what your health practitioner has told you you can and can't do. So don't go trying this at home if you haven't been advised to do so. This is just a guide for other people and other therapists to get them started on the process. Okay, thanks for listening. I'll continue the shoulder in my next video as well. Take care. Bye.